Hello everyone, I'm Mark Zigal Agam and I will be presenting to you the nursing care plan for your hospital case study. A nursing care plan is a formal process that includes correctly identifying existing needs as well as recognizing potential needs or risks. This provides a means of communication among nurses, their patients, and other healthcare providers such as your doctors, lab technicians, or even the pharmacists to achieve healthcare outcomes. Here are the objectives in writing a nursing care plan. First, it promotes evidence-based nursing care and to render pleasant and familiar conditions in hospital or healthcare centers. Another one, it supports holistic care which involves the whole person, including physical, psychological, social, and spiritual in relation to management and prevention of the disease. It also established programs such as care pathways and care bundles. It identifies and distinguishes goals and expected outcomes, review communication and documentation of the care plan, and to measure the nursing care to your clients. So here is the nursing care plan format for your hospital case study. Your NCP consists of an assessment, diagnosis, scientific background, planning, implementation, rationale, and your evaluation. The purposes of a nursing care plan are the following. First, it defines nurses' role. This helps to identify the unique roles of nurses in attending the overall health and well-being of clients without having to rely entirely on a physician's order or interventions. Second, it provides direction for individualized care of clients. This allows the nurse to think critically about each client and to develop interventions that are directly tailored for the individual. Third, continuity of care. Nurses from different shifts or different floors can use the data to render same quality and type of interventions to care for clients, therefore allowing clients to receive the most benefit from treatment. Next, fourth one is documentation. It should accurately outline which observations to make, what nursing actions to carry out, and what instructions the client or family members require. If nursing care is not documented correctly in the care plan, there is no evidence the care was provided. Number 5. Serves as guide for assigning a specific staff to a specific client. There are instances when client's care needs to be assigned to a staff with particular and precise skills. Number 6. Serves as guide for reimbursement. The medical record is used by the insurance companies to determine what they will pay in relation to the hospital care received by the client. And number 7, it defines client goals. It does not only benefit nurses, but also the clients by involving them in their own treatment and care. Let's proceed to the assessment. Your assessment is the first and most critical phase in making your nursing care plan. We actually have two sources of data. The primary source of data, which is actually directly obtained to our client, and our secondary source of data, such as your vital registries, health records, and also the significant others. In collecting a data, we should do observation, interview, and examination. And by that, we can already obtain the types of data such as your subjective and your objective data. Always remember that subjective data are elicited and verified by the client, while your objective data are directly or indirectly observed through measurement. So our source for subjective data are clients, the family, client record, and other healthcare professionals, while your objective data are your observations and physical assessment findings of the nurse or other healthcare professionals, the documentation of assessments made in client record, and the observations made by the client's family or significant others. In subjective data, the method used is client's interview, while your objective, the client is actually being observed and for physical examination. The skills needed to obtain your subjective data is through interview and therapeutic communication skills, caring ability and empathy, and listening skills, while the skills needed to obtain your objective data are inspection, palpation, percussion, auscultation. The examples of your subjective data: I have a headache. It frightens me. I'm not hungry. While your objective data are the following: respiration of 16 per minute, blood pressure of 120/80, and an apical pulse of 86. And an X-ray film reveals fractured femur. Documentation of assessment data is an important step of assessment because it forms the database for the entire nursing process and provides data for all other members of the healthcare team. So here is an example of your assessment. For your subjective data, mainit ang pakiramdam ko as verbalized by the patient. Your objective data would be the following: flushed skin, warm to touch, restlessness, and vital signs taken as follows: your temperature, pulse rate, your respiratory rate, and your blood pressure. Now that we are done with your assessment, let's go on with your diagnosis. Diagnosis is an analysis of subjective and objective data to make a nursing judgment. The components are the following. We have P, E, and S. For P, this means the problem statement. So we're going to give a diagnostic label or definition. For your etiology, these are the related factors, your causes, and your signs and symptoms, which will be stated as evidence by. Now, let's differentiate your nursing diagnosis versus medical diagnosis. Your nursing diagnosis is directed towards the patient and his physiological and psychological response, while your medical diagnosis, on the other hand, is particular with the disease or medical condition. So this means that it is actually centered on the illness. Now, let's take a look at the comparison of nursing and medical diagnosis. We have the NANDA International, or NANDA-I. This is earlier known as the North American Nursing Diagnosis Association, or NANDA. This is the principal organization for defining, distribution, and integration of standardized nursing diagnosis worldwide. So we will actually be using this book as a guide for us to make a nursing diagnosis. So we actually have types of nursing diagnosis. First is the problem-focused diagnosis, in which a client problem that is present at the time of nursing assessment. So these diagnoses are based on the presence of associated signs and symptoms. We also have your risk diagnosis. These are clinical judgment that a problem does not exist, but the presence of risk factors indicates that a problem is likely to develop unless nurses intervene. We also have your health promotion diagnosis, which is also known as your wellness diagnosis. So in here, a clinical judgment about motivation and a desire to change to increase your well-being of the client. Health promotion diagnosis is concerned in the individual, family, or community transition from a specific level of wellness to a higher level of wellness. And we also have your syndrome diagnosis, wherein a clinical judgment concerning with a cluster of problems or nursing diagnoses that are predicted to present because of a certain situation or event. Here are the examples of nursing diagnoses. First, we have the actual problems. Ineffective airway clearance related to retained secretions. Acute pain related to post-surgical incisions. Anxiety related to change in health status. And body image disturbance related to temporary presence of nasogastric tube. Here are the potential problems. Risk for infection related to post-surgical incision. Risk for constipation related to inactivity and insufficient fluid intake. And risk for injury related to decreased vision after cataract surgery. We also have your health promotion diagnosis. Readiness for enhanced spiritual well-being. Readiness for enhanced family coping. And readiness for enhanced parenting. While your syndrome diagnoses are the following: chronic pain syndrome, post-trauma syndrome, frail elderly syndrome. Always remember that setting priorities is the process of establishing preferential sequence for addressing nursing diagnoses and interventions. In this step, the nurse and the client begin planning which nursing diagnosis requires attention first. Diagnoses can be ranked and grouped as to having a high, medium, or low priority. Life-threatening problems should be given the highest priority. Since you already obtained your assessment, we are now ready to make our nursing diagnosis. Based from our obtained assessment, our nursing diagnosis would be hyperthermia related to inflammatory process as evidenced by flushed skin, warm to touch, restlessness and body temperature of 38.1 degrees Celsius, and the verbalization of mainit ang pakiramdam ko by the patient. So here is the example of our scientific background. The entry of pathogens in the systemic circulation causes a regulation of toxins in the body, thereby releasing of pyrogen. This would stimulate the hypothalamus, causing an increase or alteration of your thermoregulation, thereby causing an increase in body temperature and your hyperthermia. Now, we are ready for your planning. Planning is the formulation and documentation of measurable, realistic, and client-focused goals. We are also going to promote client participation and determine the outcome criteria. So, this should be specific, measurable, attainable, realistic, and time-bounded. So, always remember that planning should be SMART. Goals may be short-term or long-term. A short-term goal might be client will raise right arm to shoulder height by Friday. In the same context, a long-term goal might be client will regain full use of right arm in 6 weeks. Short-term goals are useful, first, for clients who require healthcare for a short time, and second, for those who are frustrated by long-term goals that seem difficult to attain and who need satisfaction of achieving a short-term goal. In acute care setting, much of the nurse's time is spent on the client's immediate needs, so most goals are short-term. However, clients in acute care settings also need long-term goals to guide planning for their discharge to long-term agencies or home care, especially in a managed care environment. Long-term goals are often used for clients who live at home and have chronic health problems, and for clients in nursing homes, extended care facilities, and rehabilitation centers. Always remember that goals are derived from the client's nursing diagnosis, primarily from the diagnostic label. The diagnostic label contains the unhealthy response. It states what should change. For example, if the nursing diagnosis is Impaired tissue integrity related to destruction of tissue secondary to pressure and friction as evidenced by stage 2 pressure ulcer on coccyx, our long-term goal would be patient's pressure ulcer will heal before discharge, while our short-term goal would be patient will demonstrate 3 measures that she can do to prevent pressure ulcers during my shift. So for our nursing diagnosis, our plan would be after 2 hours of nursing intervention, the patient will maintain court body temperature within normal range as evidenced by body temperature of 36.5 degrees Celsius, skin is cold to touch and less flushness, and verbalized relief and comfort. Now that you are done with your planning, you've already set your goals and objectives to your clients. Now, let's proceed to your implementation. In the nursing process, implementing is the action phase in which nurse performs nursing interventions. It consists of doing and documenting the activities that are specific nursing actions needed to carry out the interventions. The nurse performs or delegates the nursing activities for the interventions that were developed in the planning step and then concludes the implementing step by recording nursing activities and resulting clients' responses. Although the nurse may act on the client's behalf, professional standards support client and family participation as in all phases of the nursing process. The degree of participation depends on the client's health status. Always remember that in implementation, we're going to put nursing care plan into action. We're going to reassess the client, determine the nurse's need for assistance, supervise delegated care or task, and document nursing activities. We have 3 types of interventions. We have the independent nursing intervention, dependent nursing intervention, and your collaborative intervention. For your independent nursing intervention, these are activities that the nurse are licensed to initiate based on their sound judgments and skills. It includes ongoing assessment, emotional support, providing comfort, teaching, physical care, and making referrals to other healthcare professionals. Again, your independent nursing intervention is actually a nurse-initiated. Next one, we have your dependent nursing intervention. These are activities carried out under the physician's order or supervision. It includes orders to direct the nurse to provide medications, intravenous therapy, diagnostic tests, treatments, diet, and activity or rest. Assessment and providing explanation while administering medical orders are also part of the dependent nursing intervention. Again, for your dependent interventions, it is doctor-initiated. And lastly, we have your collaborative intervention. These are actions that the nurse carries out in collaboration with other healthcare team members, such as physician, social workers, dietitian, and therapists. These actions are developed in consultation with other healthcare professionals to gain their professional viewpoint. For your collaborative intervention, this is collaboration with other healthcare team professionals. Based on the planning, we already made our interventions, and for each interventions must correspond a rationale. First, we need to monitor core body temperature because temperature of 38.9 to 41.1 degrees Celsius suggests acute infectious disease process. Next is to encourage patient to increase oral fluid intake. If you have a fever, your body sweats and loses fluids and minerals. An increase in oral fluid intake will help reduce fever and replenish the body. Third is to provide TSB as needed. This is to decrease body temperature by means of evaporation. Another independent nursing intervention is to promote bed rest, relaxation techniques, and diversional activities. This is to reduce metabolic demands or oxygen consumption. Number 5 is we need to raise side rails at all times. for us to ensure the patient's safety even without the presence of seizure activity. Number 6, we need to educate patient and family members about the signs and symptoms of hyperthermia and help in identifying factors related to occurrence of fever. Discuss importance of increased oral intake to avoid dehydration. Because providing health teachings to the patient and family aids in coping with the disease condition and could help prevent further complications of hyperthermia. While your dependent interventions are the following. Administer antipyretics such as paracetamol as ordered to treat underlying causes, such as your hyperthermia. Number 8 is to administer replacement fluids and electrolytes. This is to support circulating volume and tissue perfusion. And finally, you're done doing your nursing care to your clients. Now, let's proceed to your evaluation. To evaluate is to judge or to praise. Evaluation is the last phase of the nursing process. This should be planned, ongoing, purposeful activity in which clients and healthcare professionals determine first the client's progress towards achievement of goals or outcomes, and second is the effectiveness of the nursing care plan. Evaluation is an important aspect of the nursing process because conclusions drawn from the evaluation determine whether the nursing intervention should be terminated, continued, or changed. Always remember that evaluation is continuous. Through evaluating, nurses demonstrate responsibility and accountability for their actions, indicate interest in the results of the nursing activities, and demonstrate a desire not to perpetuate ineffective actions but to adopt more effective ones. Our evaluation is after 2 hours of effective nursing intervention, the patient's body temperature decreased from 38.1 degrees Celsius to 36.7 degrees Celsius. Skin is cool to touch with no flushing. Patient expressed relief with verbalization of hindi na po mainit ang pakiramdam ko. This means that our goal is met. Thank you so much for listening. Have a good day.